whispered that the NHS is a burden, too expensive, inferior to the market. And today those voices grow louder, exploiting the crisis in our NHS in order to dismantle it. They say that universal healthcare could be afforded in the 20th century, but not in the 21st. This Labour government rejects their pessimism. So does the public. But that is the choice. It really is change or bust, and we choose change. Over the past 8 months, we've led the biggest conversation about the future of our health service in history. We engaged more than 1 million people, with 250,000 sharing their experiences and their ideas. We consulted NHS and care staff, royal colleges, think tanks, trade unions, and so importantly, patients themselves. No one defends the status quo. Now, I'm sometimes told that NHS staff are resistant to change. On the contrary, they are crying out for it. They're the ones who have to suffer the moral injury of seeing their patients treated in unfit conditions. And they're also the ones that are driving the innovation on the front line. And so their fingerprints are all over this plan. The public are desperate for change too. Each of us has our own story about the NHS and the difference it's made to our own lives. And we also know the consequences of failure. That's why we can't afford to fail. To succeed, we need to defeat the cynicism that says that nothing ever changes, they're all the same, and the NHS can't be reformed. We know that the change in our plan is possible because we see it already happening. We toured the length and breadth of the country and scouted the world for the best examples of reform. If Australia can effectively serve communities living in the remote outback, we can meet the needs of people living in rural England. If community health teams can go door to door to prevent ill health in Brazil, we can do the same in Bradford. We know we can build the neighbourhood health service because teams in Cornwall, Camden, Northumbria and right here in Stratford are already showing us how to do it. So we'll take the best of the NHS to the rest of the NHS, and we'll apply the best examples of innovation from around the world to benefit millions of people here at home. The science is on our side. The revolution in genomics, artificial intelligence, machine learning and big data offers a golden opportunity to deliver better care for all patients and better value for taxpayers. And we are grabbing that opportunity with both hands. And above all else, we will give power to the patient. It will fulfil Nye Bevan's commitment in 1948 to put a megaphone at the mouth of every patient. We know the British people are counting on us. It falls to us to make sure that the NHS not only survives, but thrives. And we will not let our country down. Because if we succeed, together with the 1.5 million people working in the NHS, we will be able to say with pride that we were the generation that built an NHS fit for the future and a fairer Britain where everyone lives well for longer. And that's the plan we're launching today. Thank you for being here. Now, I'm afraid I have to hot-foot it back to Parliament to make a statement to MPs and take their questions. But before I do, it gives me great pleasure to introduce the woman who is backing our plan for reform with an extra £29 billion worth of investment. It is thanks to her leadership that we've seen interest rates in our country fall 4 times. It's thanks to her leadership that we see wages finally rising faster than the cost of living. And it is thanks to her leadership we have the fastest growing economy in the G7. Please give a warm hand to the Chancellor of the Exchequer, Rachel Reeves.
Good luck in Parliament. Thank you. Thank you very much. It's great to be here today. Thank you, Wes, and it's great to be here today also with you, Keir. And today, of course, is the eve of the 77th birthday of our National Health Service. A service, as Wes said, that was created by a Labour government. It was protected by a Labour government in 1997, and we will now be the government that saved our National Health Service. Our 10-year plan will get our NHS back on its feet and make it fit for the future, led by our fantastic NHS staff, and a huge thank you to every single one of you. And funded by the £29 billion that I announced in the spending review last month. I want to be clear, we are spending money on taxpayers' priorities. But that wouldn't have been possible without the measures that we took in the budget last year. We fixed the foundations and we've put our economy back on a strong footing. Our commitment to the fiscal rules has meant that we can boost investment in our public services. The work that we've already done means that we have recruited 1,700 new GPs. We've cut waiting lists and we've delivered 4 million extra appointments in under a year. That's twice as many as we promised, and that wouldn't have been possible without all of you. Making this country fairer for those who have paid in all of their lives by guaranteeing that the NHS will be there when they need it. That's vital for the millions of people who rely on our NHS. But it's also vital for our nation's finances. Because if people have timely treatment, they'll be able to return to work. If NHS staff don't have to spend all their time on endless admin and bureaucracy, then they're free to focus on the care that they are so good at delivering. And if we can prevent illness taking root in the first place, we can save on costly treatment, as well as the huge pain and heartbreak later down the line. So this is the right way forward. Good for the health of our nation and good for the health of our nation's finances. This government will always deliver on the priorities of ordinary working people. And I am proud that with this plan, the NHS will always be there for those who need it, for the next 77 years and many more beyond that too. Thank you very much. Thank you. And it's now my pleasure to welcome the person who's made this possible by winning that Labour victory last year. And without that, we wouldn't be able to fix the foundations of our economy. We wouldn't be able to deliver the free school meals in our primary schools. We wouldn't be able to build the 1.5 million homes. We wouldn't be able to do anything that me and all of our colleagues came in to do. So, Prime Minister, over to you.
Thanks, mate. Great stuff. Thank you, Rachel. Thank you, Wes. And thank you, Denise. Where's Denise gone? Denise, come and sit down with us. Because Denise's story is fantastic. As she said, she works here, she lives in this borough, and she uses the services here. And what a great testament that is. And Denise, thank you for your introduction. Thank you for your words. And it is a real privilege to be here with you in Stratford. And I've seen the work you're doing this morning. I'm sorry to be interrupting your work. I do understand how hard it is. My mum worked in the NHS. She was a nurse and a very proud nurse with it. My sister worked in the NHS, and my wife still works in the NHS in one of the big London hospitals. So I do understand what you do, how you do it, and what you put in, and why you do it as well. And so let me start by saying a big thank you to all of you for what you do. And if I may, through you, to say thank you to all the NHS staff right across the country who do what they do as public servants because they care about treating and caring for other people. Thank you also for welcoming us here to your neighbourhood health centre, because it's buildings like this here that represent the future of the NHS. And I've just had the chance to go round and see some of the work that's going on here, the 24 teams that you've got working on dentistry. Really pleased to see that you don't necessarily need an appointment. You can walk in. We've got children and families up there on the next floor having their teeth done. Hugely important. And that's what a neighbourhood health service can do, working in partnership with the people that it serves. And Denise, you're the embodiment of that. Power and control in their hands, care closer to their community, services organised around their lives. But look, I'll say a bit more about the future in a minute. But it is important that we go back a year to the NHS as it was left by the last government, with record waiting lists, the lowest ever satisfaction, and I know the toll that that takes on staff who work so hard. 100,000 children waiting more than 6 hours in A&E. Now, I'm not going to stand here and say everything is perfect now. We have a lot more work to do, and we will do it. But let's be under no illusions. Because of the fair choices that we made, the tough Labour decisions we made, the future already looks better for our NHS. And that is the story of this government in a nutshell. It's breakfast clubs, hugely important for children coming in to school so they're ready to learn. Potholes across the country filled. Fuel duty frozen. 4 interest rate cuts, hugely important for mortgage holders. Setting up Great British Energy. Levelling up workers' rights. Record investment in affordable housing. Infrastructure the length and breadth of our country. It's all down to the foundation we laid this year. All down to the path of renewal that we chose, the decisions made by the Chancellor, by Rachel Reeves, which mean we can invest record amounts in the NHS. Already over 6,000 mental health workers recruited, 1,700 new GPs, 170 community diagnostic centres, really important, already open, new surgical hubs, new mental health units, new ambulance sites, record investment right across the system. And because of all that, the results are crystal clear. At the last election a year ago, we promised 2 million extra appointments in the NHS in the first year of a Labour government. We've now delivered 4 million extra appointments, and that's thanks to all your hard work and that of your colleagues. 4 million. That's a record amount for any single year ever. And I want to thank you all for the part that you have played in that. That is what change looks like. A promise made and a promise delivered. And turning those statistics into the human is really important. So let me tell you about Jane, who I've spoken to. At Christmas, she was taken to hospital with back pain, and the diagnosis was not good. She needed her gallbladder removed. And Jane asked, as you can imagine, how long will I have to wait? And they said to her back then, I'm sorry, but at the moment, it could take up to 10 months. But because we've speeded up electives, because we've speeded up appointments, by May, she was offered a private appointment, paid for by the NHS, as part of our plan. And now Jane is pain-free, 5 months, not 10 months, and she's got 5 months back, free from pain, free from anxiety, and in a sense, her life is no longer on hold. That is what change looks like in human terms. That's the difference a Labour government can make. But we have to keep going. We are fixing the foundations. We made choices that no other government would make, and we're starting to repair the damage that's done to the NHS and public health through COVID on austerity. But reform, what we're talking about today, isn't just about fixing problems. It's also about seizing opportunities. And the way I see it, there's an opportunity here. Because the NHS is at a turning point in its history. We're an older society now. Disease has changed. Conditions are chronic. They're long-term. They need to be managed. And that means we need to reform the NHS to make it fit for the future. And with the technology that is available to us now, we have an unprecedented chance to do that, to make care better, to transform the relationship between people and the state, to give patients more power and control. And this is about fairness. Millions of people across Britain no longer feel that they get a fair deal. And it's starting to affect the pride, the hope, the optimism that they have in this great country. And our job is to change that. And the NHS is a huge part of it. I mean, for 77 years this weekend, the NHS has been the embodiment, if you like, of British pride, of hope, that basic sense of fairness and decency. 77 years of everyone paying in, working hard, doing the right thing, secure in the knowledge that if they or their family needs it, the NHS will be there for them. In 10 years' time, when this plan has run its course, I want people to say that this was the moment, this was the government that secured those values for the future. And look, when people are uncertain about the deal they're getting from this country, what fairer way is there to respond than that? By giving them more control, by partnering with them to build an NHS that is fit to face the future. And that is what this plan that we are launching today will do. It will do so in 3 ways, 3 shifts, if you like, that will transform healthcare in this country. First, we will shift the NHS away from being only a sickness service to a health service that is genuinely preventative, prevents diseases in the first place. That means a stronger focus on vaccination, on screening, early diagnosis, things like innovative weight loss services, which could be available in pharmacies, working with major food businesses to make their products healthier, better mental health support, particularly for our young people. And starting with children aged 16 this year, we will raise the first entirely smoke-free generation. Second, we will shift the NHS away from being a hospital-dominated service to being a community neighbourhood health service. You can see why we chose to come here. Places like this are the future of our NHS. As I say, you don't have to book an appointment. You can walk in. There are families here. People live in this area. It is local to them. Now, of course, we will always need hospitals. They will always be important for acute services in particular. But, as I say, disease has changed, and we must change with it. And not only can we do that, we can do it in a way that improves care and convenience for millions of people. So just imagine it. Nurses, doctors, pharmacists, dentists, carers, health visitors, all under one roof. But also alongside them, services like debt advice, employment support, smoking cessation, preventative services, which we know are so crucial for a healthy life. Now, that is an exciting prospect. You know, the idea that the future of healthcare is no longer defined by top-down citadels of the central state, but is instead in your home, in your community, in your hands. That is an inspiring vision of change. It will bring the state and the people it serves into a partnership on something that we all care deeply about. But more importantly, it means a future where we have better GP access, no more 8 a.m. scrambles, more dental care for your children, better care on your doorstep, and a neighbourhood health centre like this in our coastal towns, in our rural counties, in every community across the country, every community across the country. Finally, the third shift, from the analogue NHS that we have at the moment to a truly digital health service, a health service capable of seizing the enormous opportunities that are there in science and technology, in genomics, in artificial intelligence, advanced robotics. And look, all of you will have seen in your everyday lives what this can do, and I've seen some of it as well. I've spoken to stroke patients whose lives have literally been saved by technology and AI because it could find the blood clot in their brain in milliseconds, giving them just enough time to be operated on and saving their lives. So this plan, this 10-year plan, backs technology to deliver. because it can and will save thousands of lives. But it's not just about saving lives. AI and technology is an opportunity to make services more human. That always sounds counterintuitive, that AI and technology make us more human. But it does, because what it gives all of you and all of your colleagues is more time to care, more time to do the things that only human beings can do, which is that care that is needed, the professional skills that you have. So this will make it a more human service as well. And it's not just cutting-edge stuff. Technology like phones in the pockets of everyone in this room. We can make use of that as well. Now, it's not often I invite people to look at their phones when I'm making a speech, but if you get your phone out and look, you've got lots of apps on your phone. Seriously, because what you're going to see on your screen if you have a look at it is that entire industries have reorganised around apps. Retail knows the power of it, transport, finance, weather, you name it, shopping. Why can't we do that with health? Why can't we have that app on your phone? Why not the NHS app on your phone? Making use of the same dynamic force to cut waiting lists at your hospital, to make it easier to book an appointment with your GP, to give you more control over our health. There is no good reason why we can't. And so I'm announcing today, as part of this plan, that we can and we will transform the NHS app so that it becomes an indispensable part of life for everyone. It will become, as technology develops, like having a doctor in your pocket, providing you with 24 hours advice, 7 days a week. An NHS that really is always there when you need it. Booking appointments at your convenience, ordering your prescriptions, guiding you perhaps to local charities or businesses that can improve your well-being. And perhaps most importantly, holding all healthcare data in an easily accessible single patient record. Now, don't underestimate just how important that is. I've been up to Alderhay Hospital in Liverpool many times. It's a children's hospital. It's a brilliant hospital. And one of the times I was there, I went onto the ward where particularly young children were having heart surgery. I have to tell you, it was really humbling, both seeing what the children were going through and what the professional staff were doing. And when I went into a particular ward, I saw a 2-year-old boy who had just had major heart surgery. It's an incredible thing to see. And I spoke to his parents, who were, as you would expect, at his bedside, where they'd been throughout. And one of the things they raised with me is the distress that they felt, that they had to go through every condition he'd had and what happened to him, how it impacted him over and over and over again, when they went to Blackpool, when they went to Liverpool, when they got to Alderhay. And they were actually welling up, telling me, it's a really difficult story for us. This is really hard. And we don't want to keep on having to repeat it. Why couldn't it have been recorded in some accessible form the first time round? And I will remember their faces and that story they told me for a very, very long time. And we can fix that. We can make it more accessible. We can bring this together in one place. And there are other examples as well. That red book that every parent gets when they have a child, why can't that be digital? There's no good reason. And so that is exactly what we will do. We will turn this app into a new front door for the entire NHS, a reformed, modernised and renewed neighbourhood health service. So that is the plan that we will launch today. That is the change we will deliver, the difference a Labour government makes. The NHS on its feet, facing the future, delivering fairness and security for working people. Thank you so much. Thank you. Thank you. Thank you. It's a bit hot in here, isn't it?
Oh my God, I'm sweating. I'm absolutely sweating. It's unbelievable. I'm sorry, I'm making you look like a sweaty
We'll
mess.
keep the media questions short. Thank you all very much. I'm going to take a number of questions from the media now. We're going to keep them relatively short and free because the staff are getting very hot. So in their interests, we'll take questions. And I'm going to start with the BBC and Hugh Pym.
Thank you, Prime Minister. When will you be able to assure patients that they will be able to see a GP more easily, they'll get the mental health support they need, and they won't have to wait long hours in A&E? And another briefly, would the Chancellor like to comment on her experience in the Commons over the last 24 hours?
On the question of when you'll see the change, it's a 10-year plan, but we're already starting on the change. And if you haven't had the opportunity, I would recommend walking around here, because a lot of what I've been describing in terms of neighbourhood centres, you will see here. Not all of it, of course, but you will see the teams doing the dentistry, people walking in. And that is both incredible to have that in your community, but it ties in with my experience in Alderhay. I think you may have been there when I was there, when one of the shocking statistics, and it really did shock me, was to learn that between the ages of 8 to 12, more children come to Alderhay to have their teeth taken out because of decay than anything else. And so some of that is being dealt with the preventative measures here. So some of it is starting already. The technology is moving on. Some of it will take a bit longer because the neighbourhood centres have to be put together and the services all brought to one place. It is a 10-year plan, but we're beginning on it already. And what I have, and my intention and determination is that as we look back proudly at the Labour government that created the NHS, and we do, and celebrate it, and that's a good thing, I want in 10, 20, 30 years people to look back and say, this was the government that seized the moment and reformed the NHS so that it's fit for the future and is still celebrated year after year after year. In relation to the Chancellor, I'm not going to stand here and speak for the Chancellor, but as she's made clear on a number of occasions, yesterday was a personal issue, and I'm certainly not going to say anything more about that. I think it's just fantastic that she is here. And as I say, none of this would be happening if she hadn't taken the decisions that she's taken. So she took those decisions, and she'll be taking them for many years to come. Thank you, Hugh. Beth at Sky.
Thank you, Prime Minister. Beth Rigby, Sky News. PM, your first year anniversary has been marked by a self-inflicted shambles over welfare that's left you and your Chancellor wounded. You've U-turned on your reforms, your MPs don't trust you, and markets worry that you've lost resolve on fiscal discipline. It's the epitome, isn't it, of sticking plaster politics and chaos that you promised voters you would end. You say it's your responsibility, so can you explain to our viewers how you got this so wrong and what you intend to do to rebuild your trust and authority in your party? And if I may, I know it's long, sorry. Chancellor, first, it's really good to see you today. It's really good to see you here. But Prime Minister, I have to ask you, on a human level, people were shocked and baffled that in the Commons yesterday, you did not offer your Chancellor your support. Was it because you didn't see what was happening, or did you not know what to do? Thank you.
Well, Beth, let me just clear that up straight away. I didn't appreciate what was happening because, as you will probably appreciate, the PMQs is pretty wired. It goes from question to question, and I'm literally up, down, question, looking at who's asking me a question, thinking about my response and getting up and answering it. And so it wasn't just yesterday. No Prime Minister ever has had side conversations during PMQs. It does happen in other debates when there's a bit more time, but in PMQs, it is bang, bang, bang. That's what it was yesterday, and therefore I was probably the last to appreciate anything else going on in the chamber. That's just a straightforward human explanation. Common sense explanation, if you like. In relation to your invitation to tell your viewers what we've achieved in the first year of a Labour government, I'm very pleased to say we've brought down waiting lists. We promised 2 million extra appointments. We've delivered 4 million extra appointments. We've begun the project to build 1.5 million houses, particularly social and affordable houses. In schools, we have introduced breakfast clubs, really important for children so they're ready to learn when they get to school. We've rolled out free school meals to 500,000 more children, hugely important to them. We're just doing more on childcare. That comes on stream in September. So that is 9 months to 4 years free childcare across the country. We're ramping up and introducing the biggest upgrade in employment rights for a generation. We've got record investment into the country. Just last week, Amazon put in 40 billion investment into this country in jobs. That's one of the biggest single investments that has ever been made, and that brings the total for the year to £120 billion. These are companies, global companies and finances, who don't have to put that into the United Kingdom. They're choosing to put it into the United Kingdom because they've got confidence in what we're doing, confidence in the fiscal rules that the Chancellor has crafted so well. We've delivered a defence uplift to 2.5% and made it clear it will be felt in every community, in jobs. We've created hubs so that local businesses, small businesses benefit from that. We've delivered 3 trade deals, which government's tried for a long time. The US trade deal was talked about for I don't know how many Prime Ministers. Who came along and delivered it? This Prime Minister with this Labour government. The India deal, I think, was talked about for 8 years. Who came along and delivered it? This Labour government. And of course the EU-UK reset. And only a few weeks ago, many people were saying to me, you can't have a US deal and an EU deal, Keir. You've got to choose one or the other. And we've got both. And it's measured, Beth, by the thing that matters most to me, which is improving the lives of working people. And that trade deal with America was hugely important to JLR and the car manufacturing sector. And equally, the SPS agreement with the EU will bring down prices in supermarkets across the country. I could go on, Beth, but it's a long list of achievements of this Labour government, and I'm really, really proud of them.
You had to collapse your welfare reforms because you were going to lose a vote in the House of Commons. Are you just in denial? You've totally ignored my question.
No, I'm not, and we didn't get the process there right, but I think it's right that if we're looking at the entire year, that we look at all the things we've delivered, and I always do this through the eyes of the working people up and down the country that we came into government to serve, that really mattered to me. I actually gathered them in the back garden of Downing Street the other day. These are all the people I'd met along the way in the campaign trail, people working in the public sector, people doing campaigns, people who put in every day. I got them back, partly to show what we delivered on the commitments we made to them, partly to make sure that we always have them in our mind's eye. And they are very, very pleased that we've delivered waiting lists down, that there's housing they're going to be able to afford, that their schools are looking better, their hospitals are looking better, record investment, and all those people whose jobs are going to be either secure under JLR or created under the other investments coming in. That is what matters to me, and it's really important that I stand up and be absolutely clear. I'm very clear. I'm very proud of the decisions we've made. They were tough decisions, they were the right decisions, but only because we took them have we got this platform that we can now build on. Thank you very much, Beth. I've got Rebecca from ITV. Rebecca.
Thank you. Yeah, Rebecca Barry, health correspondent, ITV News. Prime Minister, given the current workforce crisis in the NHS, how will you ensure there are enough staff to provide these neighbourhood services? And on the Chancellor being here today, many members of the public will be concerned about her. How is she today, and is she here simply to calm the markets?
No, she's here because she's the Chancellor. The plan that we are delivering today is only deliverable because she took the decisions that needed to be taken and allocated the money for this plan. And so that is why she's here today, and I'm very glad that she is. In relation to the workforce, we have got obviously a workforce plan, and we're working with the workforce on it. The big difference between a year ago and now is that a year ago, the government was blaming the workforce for their failures. So when the past Prime Minister was asked, why aren't you hitting waiting list targets, he said, it's not my fault, it's their fault. We came along and we said, we'll work with you. And we'll get you off the picket line onto the front line. We put together a plan for the year, which we launched in the beginning of this year. That was signed by the Secretary of State and signed by the NHS. And this plan we're launching today was not something the government dreamt up and sort of imposed top-down on the staff. It was, Wes Streeting went through this, it was consulted on widely, both with staff who participated and communities that they serve. And so they recognise in this plan what their patients, their communities have always said to them. And that's why I'm really pleased that we're working together on this plan. And that's why I know that it is achievable, deliverable, and it is heartening, and I said this to the staff, to see some of it already happening right here in Stratford. Thank you very much. I've got Gary from Channel 4.
Thank you, Prime Minister. The Chancellor's said in the past that when it comes to the budget, you won't be, during this government, coming back for anything like the tax hikes in the last budget. Can you actually, hand on heart, repeat that now? Because after this week, a lot of experts, a lot of people in the city think you probably can't and maybe shouldn't.
Well, Gary, first of all, let me say what every Prime Minister or Chancellor says any time they're asked about a future budget, because it's always the same. This isn't a Labour answer or a Conservative answer, but no Prime Minister or Chancellor is going to write a budget in advance. But we did really tough stuff in that budget of last year. We made sure that we stabilised the economy, and we took the big and heavy decisions early on. And that's what we meant by what we said when the Chancellor said that before. It's what I mean and say again today. We've done a lot of the heavy lifting. We've done a lot of the hard yards. As a result of that, we're turning our economy around. The fastest growth in the G7 in the first quarter of this year, business confidence at a 9-year high, and record investment. In the end, that's what drives growth, and that's what we were saying a year ago at the other side of the election, and I say it again here today. Thank you, Gary.
Doing yesterday, because it looked rather serious for a while.
Well, Gary,
a lot of people were worried. What they were saying was they weren't sure a Labour government, maybe without Rachel Reeves in it, would balance the books.
Well, Gary, again, I think, as you know, it's unwise, and politicians don't comment on markets, and I'm not going to do so. Thank you. Andy from Channel 5.
Thank you very much, Prime Minister. Andy Bell, 5 News. Can I also say, good to see the Chancellor here after yesterday, and would invite her again, if she would like to say a few words about what happened yesterday and her reflections on that. I'll leave you to think about that for a moment. But Prime Minister, what people did see yesterday, whatever the cause in the Commons, was a Chancellor clearly under enormous pressure. Do you worry that this is becoming too much pressure for your Chancellor?
No, I have every faith in my Chancellor. She has made incredibly important decisions in the last 12 months, and we wouldn't be doing what we're doing today without those important decisions. We work in lockstep and will continue to do so for a very long time. And that is a good thing for the government. It's a good thing for the country. Thank you. Chris at GBN. GB.
Thank you, Prime Minister. Your benefits climb down this week was humiliating, but for many it's depressing because only a Labour government can properly reform the benefits system. Outside of the Timms review, is benefits reform off the table? And how will you meet this £6 billion black hole this autumn, tax rises or borrowing? And just finally, a duty of care to your team. Will you have a word with Lindsay Hoyle about what you said to the Chancellor in future, or anybody else?
I won't comment on the second issue, Chris, as you'd expect. But look, no, we are pressing on with reform. It is important that we reform the system. Welfare isn't working. The 2 examples that stick with me most are the 1 million young people who are neither earning or learning. That is not good. That is not progressive. No government should be satisfied with that, and I'm not. And we got 3 million people out of work through ill health. Again, I'm not satisfied with that. And I know from having seen it for myself, how hard it is for some people to get back into work. I've seen and talked to people who have been through ill health and want to get back into the workforce, a slight trepidation of doing so, fearing even trying, and that's why what we're putting in place, the right to try, for example. It may seem like a small thing. It is a huge thing for people who want to get back into work. The bill that we delivered on Monday obviously rebalances universal credit. That's been long overdue. And ensures that those with the severest disabilities don't go through unnecessary reassessments. That's been called for a very, very long time, and it's the right thing to do. And of course, Stephen Timms will now conduct this review. And I don't think you'll find anyone in Parliament who doesn't think that Stephen Timms is a thoroughly decent man of huge integrity that we can have faith in to do the review and make the changes that are necessary. Thank you very much, Chris. I've got Natasha from LBC.
Good morning, Prime Minister. Natasha Clark, LBC. You've made it to your first anniversary in Downing Street, nearly. You've said it's been a tough one, but the NHS, you say today, is looking better already. If you could go back in time to a year ago and give yourself any advice, what might you say? And if I may, Macron is addressing Parliament on his state visit next week. Do you think that Donald Trump should get the same privilege? Thank you.
President Macron is obviously coming next week for a state visit. That's a good thing. And as you will have noticed, the relationship between the UK and France is in a very strong place under this government. My personal relationship is very strong. Equally with President Trump, Again, the relationship between our country and the UK and the US matters hugely. It's as close as ever, and I've got a good relationship with President Trump as well. In relation to the details of his visit, I mean, they're normally set out nearer the time, so I'll come back to you on that if I may. In relation to the first point was, sorry.
What would you say to yourself if you could go back in time?
Many things. You know, focus on what matters most. And that's why when I say what matters is who you have in your mind's eye, I really mean it. Because it's very easy to think that this particular issue is of paramount importance or that particular issue, and they often are important in their own right. But I came into politics relatively late in life. I'd done other things beforehand, and I came in for one simple reason, that I wanted to change the lives of working people for the better. And I don't believe in anything else. That's why I don't believe in performative politics. I don't think rhetorical speeches without the action to back them up are worth doing or making. It's the change that you bring about. It's why I absolutely wanted to change the party so we could win an election. It's why I wanted to win that election, and why I want to change the country. And so my advice is the same advice I've always given myself. Be really clear what you're trying to achieve. Keep that focus. Don't ever be knocked off course. But most importantly, remember the people whose lives are going to be changed by what you're doing. And for me, it was really that reception, what we did the other day, getting the men and women from across the country into Downing Street, not what you might call the superstars, but in many ways the superstars, which is the men and women who are putting their lot into this country, whether it's in public service or in many, many other ways, coming in and reminding me and being with me, this is who we're doing it for. And that's always been the approach I take, and I'll continue to take it. Thank you very much indeed. Sophie from the Mirror.
Sophie Huskisson from the Daily Mirror. We know that poverty is a key driver of ill health and burden on the NHS. Given concessions made to your welfare plans come at a financial cost, can you confirm whether scrapping the 2-child benefit limit is still on the table? And if I may, another quick one, can I ask for your response to the news that Liverpool football player Diogo Jota and his brother have died in a car crash?
Let me start with Jota, because this is devastating news. And I'm sure I speak for everyone in saying our first thoughts are going to be with his family and his friends in particular. But there are millions of Liverpool fans, but also football fans, non-fans, who will also be shocked by this. I think Liverpool Football Club have just put a statement out, as I understand it, but it is devastating, and it is really important that we bear in mind just how difficult a period this will be for his friends and for his family. In relation to child poverty, let me be really clear. The last Labour government drove down child poverty, and it was one of the proudest things that we did. Sadly, the last government allowed child poverty to go back up again. I'm determined that this government will drive it down, just as the last government did. We've got a strategy and a task force working on this. We'll lay out the full details of that. I personally don't think there's a silver bullet, but if you do this one thing, it will deal with child poverty. I think we've got to look at a range of things, including, of course, the sort of stuff that's in this plan today, including what we're doing, helping people back into work, but many others. The breakfast clubs, the free school meals are all part of the work that we've already started on in relation to child poverty. We'll set that out, but as I say, I've never personally believed that there's one silver bullet, that's the one thing you need to do, and nothing else. I don't think that is actually going to achieve it, and therefore the plan will be much more broad-based and comprehensive than that. Thank you so much. I've got Sean from the Mail. Sean.
Hiya, Sean Wooler from Daily Mail. To deliver this 10-year plan, you would need a third term in government. How confident are you that you can carry the public support and your MP support for that long? And how many years will they have to wait until they can see a GP when they need one, and be confident an ambulance will arrive within minutes rather than hours when they call 999?
I'm very confident, because this government was brought into power to bring about change. People desperately want change on so many levels, but one of the things that came through in the election campaign loud and clear is please change the NHS for the better, because nobody wants their NHS to be, I used to say on its knees, actually it was on its face. The staff don't want that, I know that it broke the hearts of staff to know that satisfaction in the NHS was at an all-time low. Imagine working really hard in the NHS, and because the government hasn't given the resources and the backing to the NHS, satisfaction is an all-time low and waiting lists are an all-time high. When Labour last was in power, we left with the lowest waiting list and the highest satisfaction. That's where we need to get to. And the reason I'm confident that we can deliver that, and I've always said it's a 10-year renewal plan for the government as a whole of the country, a rebuild, but this plan is a 10-year plan. I'm confident in that because it reflects what the public, the communities have put into the plan. This wasn't a plan which we sat in Downing Street and wrote out. It's a plan that we asked those who use the NHS what they wanted to see changed. We asked the staff as well, and that's why I have utter confidence in it. Thank you very much, Sean. I've got Chris from The Times.
Thank you. Chris Smythe from The Times. Basically, every plan for the last few decades has set out the same vision as we've got here, talked about the same shifts and had the same goals. None of them have worked. What in this plan makes you convinced that this time will be different? And is part of what you're saying to staff, given the financial situation and your political opponents, that if it doesn't actually change this time, the NHS might not exist in 10 years? And if I could just add on the events of yesterday, having to drag your Chancellor here to look performatively happy in front of the cameras, does it say something a bit unpleasant about politics?
Well, Chris, I don't think that's an accurate or fair description in relation to today. But just in relation to the NHS, we're putting in the resource, we're putting in the priority, and we've got the resolve to see this through. And in the end, I genuinely believe it's only Labour governments that can do this. It was a Labour government that created the NHS. In the teeth of opposition from others, the Conservative Party couldn't have done it, and we did it. I think it's only a Labour government that can therefore make the NHS fit for the future. But we've got the resolve to do it, the determination. We've got the government that sits right behind this. And the way we're doing it is to work with the NHS rather than blaming them when anything goes wrong. And that's the difference. We'll deliver it. And I'm really pleased that I can evidence that by the work and the changes that have already happened. As I say, I'm really proud of this. I'll say it again. We promised 2 million appointments. It's a big thing to promise before an election because I know that if I was standing here a year down the line and we'd only delivered 1 million extra, you would all be saying to me, you've broken your promise, haven't you? We went through the 2 million threshold, I think, in about 7 months. And then it went up to 3 million, then to 4 million. I'm really proud of that, but I know that only happened because we worked with the NHS and put the resource in and the backing. And now, again, back to the people that matter most to me, people are now getting their appointments more quickly as a result of the changes we've made. Jane is a small human example of that, but Jane would still be having back pain today if we hadn't brought about the faster appointment in her particular case. I've got Peter, I'll take from The Guardian, then we're going to call it a day because it's getting very, very hot in here, and I'm just conscious.
I'll keep this as brief as I can, and if ever anyone collapses in the background, I'll be sure to let you know. Just if you talk to anyone who works in the NHS, they all say that one of the big things that can save it is improving the lives that people lead, and public health measures like that often get bogged down in kind of nanny state arguments and things like that. Is there anything in the 10-year plan that's going to be different to what's been promised before? And if I could just very, very quickly follow up Sophie's question. One of my colleagues wrote a story this week that contained the calculation that economic inequality costs the NHS about £50 billion a year. Do you accept that tackling poverty is a key part of this 10-year plan?
Firstly, let me take head on the so-called nanny state charge, because when I learned at Alderhay that children of that age, 8 to 12, were coming in to have their teeth taken out, and that was the major cause, the highest cause of admission, I'm not interested in an argument about nanny state. If the price of not doing it is a child losing his or her teeth before they're 10 years old, I'll take those measures any day of the week, and I'll defend them any day of the week. And it's not just the child going in to have their tooth taken out, which is shocking, and it should be shocking for everybody. It is also, I saw brilliant professionals at Alderhay, the best staff in that children's hospital, and they were having to use their time and skill to take teeth out, rather than do the heart operations, to do the other operations that they need to do, to take teeth out, completely unnecessary, preventable measure. And that's why I think we absolutely have to take these preventative measures, and we're quite right to do so. I learned this morning, actually, from the team here. One of them, a number of years ago, I won't say how many years ago, but she's experienced. She said they actually used to do the teeth brushing years ago in schools. It wasn't uncommon for that to happen. It's not a new development. It's very common sense. It's an example. But what I won't tolerate is children losing their teeth or brilliant staff having to spend their time carrying out preventable and unnecessary measures when they would much rather be using their skills to do other things, as they are doing here. I mean, I was really struck. There was a young family in having their teeth checked and done this morning. That is exactly what we want in a walk-in service. On the question of inequality, yeah, the two are tied up. We have to reduce poverty. There are a number of ways of doing that. I'm really pleased, for example, that we increased the minimum wage this year. That's £1,400 more on average for those on the minimum wage. It's a really important measure that we are taking. Free school meals saves families money. Free childcare saves a huge amount of money for families. Breakfast clubs as well. There are a number of measures we're taking to reduce the burden of the cost of living, because I know absolutely that inequality and poverty are linked to ill health, and we'll continue to take those measures. Thank you very much. We really will release everybody now. I say thank you to all the staff. That was very, very hot, wasn't it? Apologies.